Hi, Kate.
Hi there.
I'm Eva. Nice to meet you.
Nice to meet you too.
So I'm here today to talk to you about what we found in your exam today while you're in.
Okay.
Something I would like to bring to your attention is that we did find plaque in between your back teeth on both sides.
Okay.
And along with the plaque there, we did find what we call moderate gingivitis, or what swelling or redness of the gingival tissue back there. But a great thing that we see that you're doing is you're brushing really well, because the plaque is very minimal along the margin of your gingiva that kind of hugs the tooth. So keep up the good work with your brushing at home. The reason why we find the plaque problematic is that it could cause incipient lesions in between your teeth, or what we call cavities. Are you familiar with the caries process at all, or kind of what causes it?
Yeah, not really. I've never had a cavity before in my mouth, so I'm not sure what causes them. I know, I'd like to know more, I guess.
Okay, well, great. Yeah, I can explain it to you. Why plaque is harmful in your mouth is that it carries bacteria.
Okay.
And what happens is when you put a sugar in your mouth, such as from candy or soda pop, or even a fermentable carbohydrate such as from cookies or cakes, is that the bacteria loves that and it feeds off it.
Okay.
And then what happens is the bacteria produces an acid, and this is what we call an acid attack. When there's too much acid in your mouth, it lowers the pH and it causes your tooth to demineralize or erode the enamel surface. We want to do our best to prevent that.
Yep.
And along with the harmful effects of plaque and cavities, plaque is also harmful to your gums. And what I was telling you about before was the gingivitis. When the plaque sits, underneath, your gum tissue, it irritates it.
Okay.
And the bacteria in there irritates it. And what your body then does is it causes a host response, or your body initiates swelling in those, infected areas. And that is what causes, the swelling, the redness, and the bleeding in your tissues there.
Okay.
But the good thing is that it is reversible with good home care. So, that's something that is positive about that, because we don't want it to progress into a worse disease like periodontitis, which can cause bone loss, and it's an irreversible disease. So we want to kind of keep it here and reverse what we see now. But what I would like to know from you is, what changes would you like to see in your oral health as of now?
I would like the pain in my back to kind of go away.
Yeah.
Like I was saying, it's kind of, you noticed it was red, and I can, I know, it seems kind of tender back there.
Right. So how important is it to you to kind of make that change?
It's very important. I don't want to have any cavities. I haven't had one yet, and I'm still so young. I want to maintain that health, and I don't want it to progress any farther.
No, that's definitely great that you have the desire to keep a healthy mouth, especially at a young age, because this is when it counts the most. How are you currently cleaning between your teeth at home? Are you using anything special, or what's kind of your daily routine?
I guess my daily routine is in the morning just to brush my teeth, and then go to school, and when I get back I don't really do much, then just brush my teeth at night. I think brushing was just all I do.
Okay. And the flossing, do you do that ever, or is it something that...
Not ever, really. I don't really like putting my fingers in my hands. It kind of grosses me out. I don't like the floss to wrap around my fingers. I just really don't like flossing at all.
Okay. Well, those are good things to hear. Is there an alternative you can think of to floss that would maybe be more practical or easier to use that you can think of?
Yeah, I don't know. I saw a commercial recently for, I don't know what it was called. Maybe you could help me out, but it's kind of a less invasive. It doesn't have that much string, and it's kind of plastic, if you know what I'm talking about.
I know exactly what you're talking about, like the floss picks. I think they have a little handle on them.
Yeah.
Are you familiar with kind of how they work, or how to use them?
Yeah, I don't really know. I don't know much about them, and I was kind of wondering if that's the norm to use, or if I need a floss.
Well, I can tell you for your case, I think they'd be a great alternative to floss for many reasons, actually. One of them being is they do have a handle, so you don't have to be necessarily putting your fingers way back in your mouth or getting them all goopy. They are disposable, so you can use them, pick, and then just toss them right in the garbage. Another great thing is that they are affordable.
Good.
They come in bulk, so they come in big bags, and they're easy to just kind of leave around your house in little spots that you're, frequently you frequently are, so they're constant reminders to use them.
That'd be great.
Your teeth. Keep them in your car, in your back pocket. I think that's just a great alternative.
Good.
And if it's something, that you are motivated to use, I think that'd be great.
Mm-hmm. I think I'm excited about that. I think that'll be something I can do. Because, like I said, it's the floss. It kind of grosses me out. So if I just have them when I'm watching TV, I will totally be able to have them and just pick them up and...
Yeah. Well, great. I'm glad you have a good attitude about it.
Yeah.
So, we'll work on that. And then at your next appointment, we'll kind of, bring, recheck the spots that, we were worried about today and see if they've improved or if the plaque has, minimized or gone away.
Great.
So good. Well, thank you. I'm glad that, we found an alternative for you to use.
Thanks.
Great.